So this patient's coming in for removal of a mobile lesion on his scalp. It's not overly large. We just marked the margins of it. But you can definitely feel there's a pilar cyst that's underneath there. We just clipped his hair here a little bit. This one's, it should be pretty accessible one way or the other. The smaller ones are a little bit harder. You have to be more patient with it. Medium size are the simplest. Even large ones are simpler, only because it's a smaller space to work within. But this shouldn't be complicated at all. Things you just want to be considering is how the patient's laying. Obviously, this is simple because it's at this section, but if it was more towards the back, we were having him turn more, you have to worry about bleeding planes and make sure it doesn't bleed into his face or anything like that. Doesn't hurt when I do that?
Nope.
Comfortable? So he has a circumferential block in place, so there's lidocaine that's there. This is our number 15 blade. Incision here. So pilar cysts are pretty simple. The biggest issue is just progressing slowly. Once you find the right plane, this will open up for us once we're through the dermis and just above the cyst, and then we should be able to dissect that down and pop that out. So it's opening up already. Yeah, even there I can feel it. So you can see that already. Like that's the top of the cyst, it's right there. So again, I just use the Cryleys to hold that and protect the underlying cyst, and then I'll extend that just a little bit, just like that. Do the same thing this way. Very good. It's ruptured a little bit. So I rotate that around, and that pops out, just like that. Put that in the jar for me. So it's completely intact. You can see it just ruptured at the top. You're comfortable? Just put pressure there.
Me, yeah.
Yeah, you're good. So that came out intact, no issues. Just out of my head. So these ones, if you're watching these videos, you may wonder why we're not trying to use cautery and actually cauterize off these vessels. With pilar cysts, because everything's so superficial, any small bleeders like this, capillaries, we're going to catch them with the actual stitches. So these ones where you might see with epidermal cyst, where I'll actually cauterize and make sure that the back end in particular isn't actively bleeding. With the pilar cyst, we never do that just because it isn't relevant. And you'll notice a difference like this that's still oozing a little bit. There's a capillary that we haven't caught with the actual stitch, but once we hit it, you'll just notice that that settles down completely and goes away. You're still comfortable?
Yep.
So where I'd worry against backfilling, which again I've never seen in my career, is you can see the surrounding tissues here, everything's still flat. Now, if we were seeing that that was getting really swollen and boggy, it means that there's some bleeding that's going on internally that we're not sort of dealing with. So it seems like a bit of an ooze here. This is just a superficial capillary that will stop probably with this stitch. And then we'll just put a pressure dressing. So what we end up doing with these pilar cysts, we send people out with a bit of a turban on just for a couple hours, and then that takes care of anything else that might be still present. Hematomas that we talk about, so anybody who does these procedures, we usually quote a rate of about 1 to 2% of the time you get hematomas. Again, knock on wood, I've never ever seen it with pilar cysts. It just doesn't happen. Can I have some chlorhexidine?
Yeah.
There it is. So again, here, now that we're done with the stitches, I'm just going to clean this up. So any hair or stitch that's caught in this, I'm going to just clean that out now. But you can see here, there's no bogginess that's there. It's not oozing anymore. So the capillary was probably up here and the last stitch caught it. But if I was worried about that and this was backfilling, it was really quite boggy, then you might argue, do we have to sort of put in a deeper stitch or do something extra? But we don't have to do anything here. So I'm just going to clean out these stitches in the hair and then he's all done.